Let's talk about something so many women experience yet often brush off: painful periods. For some women, it's a mild discomfort that comes and goes, but for some others, the pain is so bad that it affects school, work, and even simple daily activities. If you are one of such women, you are not alone, because there are real reasons why this happens and there are ways to manage it. In today's video, we'll talk about what painful period means, the types, common causes, and most importantly, what you can do to get relief and when you should see the doctor. When we talk about painful periods, doctors use the term dysmenorrhea. It is the medical name for it. There are two types: primary and secondary dysmenorrhea. In primary dysmenorrhea, the uterus is healthy. There are no problems with the pelvic organs. The pain happens because of the way the uterus reacts to hormonal changes during the menstrual cycle. After ovulation, progesterone levels in the body rises to prepare the uterus for a possible pregnancy. Now, when pregnancy doesn't happen, that progesterone level drops sharply before your period begins. That sudden drop triggers the release of chemicals called prostaglandins. There are natural chemicals in your body that help your uterus contract to shed its lining. A small amount of prostaglandin is normal. It's what helps your period flow. But sometimes the body produces too much of it, and this makes the contractions stronger and more painful. Now, when the uterus contracts that hard, it squeezes its own tiny blood vessels, thereby reducing blood flow and cutting off oxygen supply to the muscle. And just like any other muscle that doesn't get enough oxygen, the uterus starts to cramp and ache. That temporal oxygen deprivation is called ischemia. It is what is responsible for the sharp cramping sensation so many women describe. Now, when the muscles relax and blood flow returns, the pain eases. This is why period pain comes in waves and not as a steady dull ache. Sometimes you might also notice that the pain appears to be coming from your lower back and your thighs. This is called referred pain. It happens because the nerves supplying the uterus share common pathways with nerves supplying the lower back and the legs. So when the uterus contracts painfully, the pain appears to be coming from those areas too, because of those shared pathways, not because there is something wrong with those areas. So who is more likely to experience primary dysmenorrhea? There are some factors that make some women more likely to experience primary dysmenorrhea. Examples: if you started your period early, before the age of 12, if you smoke, you are obese, you have a history of heavy and prolonged periods, and also if you have a family history of painful periods. It is also worth mentioning that different individuals have different pain threshold. What is severe to me might be mild to you, and that is completely valid. So let's talk about the second type, secondary dysmenorrhea. Unlike primary dysmenorrhea, where the uterus is healthy but just overreacts to hormonal changes, in secondary dysmenorrhea, there is an underlying medical condition that causes or worsens the pain. The pain is not just due to prostaglandin, it is because of a problem in the uterus or nearby organs. It can happen at any age, but it is commoner in women in their late 20s to 40s. In this case, the pain is similar to what you have always known as period pain, but the pattern changes. You may notice that at first, your periods weren't that painful, maybe just a mild discomfort, but suddenly or gradually the pain becomes much more intense. The pain may start a few days before your period comes, continues throughout, and sometimes linger even after your period has gone. You might also notice some other symptoms like bleeding between periods, pain during sex, bloating, pressure or heaviness in the pelvic area, and even unusual vaginal discharge. When you start noticing these symptoms, it is a sign that we are no longer just dealing with simple hormonal cramps. Something else is causing the pain, and that is what we call secondary dysmenorrhea. There are some common causes of secondary dysmenorrhea. Number one, pelvic inflammatory disease. This is a common cause of secondary dysmenorrhea among younger women. It happens when bacteria, usually from sexually transmitted infections, enters into the uterus and fallopian tubes. This infection causes inflammation and scarring, and this can make periods more painful. Women with pelvic inflammatory disease may also experience other symptoms like fever, unusual vaginal discharge, and pain during sex. The second one we'll talk about is fibroid. Fibroids are non-cancerous growths in and around the uterus. Depending on their size and position, they can cause heavy bleeding, clotting, and painful periods. The uterus has to contract harder to push out the blood clots, and this can make the periods more painful. The next one we'll talk about is endometriosis. Endometriosis is a well-known cause of secondary dysmenorrhea. In endometriosis, the tissues lining the inside of the uterus grow in other areas of the body, like the fallopian tube, the ovaries, the bowels, and even the bladder. Every month, these tissues react to hormonal changes, just like the tissue lining the inside of the uterus. They thicken and bleed, and because there is no way for the blood to leave the body, they cause swelling, inflammation, and pain. The pain of endometriosis starts before the period, continues throughout, and lingers even after the period has ended. Women with endometriosis may notice other symptoms like pain during sex and difficulty conceiving. The fourth one we'll talk about is adenomyosis. In adenomyosis, the tissue lining the inside of the uterus grows into the uterine muscle. Every month when you have your period, these tissues react to hormonal changes and they also bleed, but this time they bleed inside the muscle of the uterus. This leads to a tender and an enlarged uterus. These women will complain of heaviness or pressure in their pelvic area or lower abdomen. Other less common causes of secondary dysmenorrhea include uterine polyps, intrauterine cysts such as the non-hormonal copper type, scar formation from a previous pelvic surgery, or after childbirth. So, how do we diagnose painful periods? If your period pain starts to get worse or feels different from what you have always known, then it is a good idea to see a doctor. Usually, the doctor will start by asking you some questions like when the pain started, how long it lasts, whether it is getting worse, and if you are experiencing other symptoms like pain during sex, bleeding between periods, unusual vaginal discharge, and if you are finding it difficult to conceive. This medical history is important because it helps the doctor differentiate between primary and secondary dysmenorrhea. Next, the doctor will do a pelvic examination to check for tenderness, swelling, or anything unusual with the uterus or ovaries. Depending on your age and sexual activity, the doctor may do a speculum examination to examine the cervix and take samples if an infection is suspected. If something more serious is suspected, the doctor may recommend for other investigations like swab tests to rule out a pelvic infection, ultrasound scan to check for uterine fibroids, polyps, adenomyosis, and ovarian cysts. Other more invasive tests may also be requested for like laparoscopy, hysteroscopy, and hysterosalpingogram. All these tests help the doctor identify the cause of the pain so that treatment will be targeted at the root cause, not just at the symptoms. Now, let's talk about treatment and relief options. The first one we'll talk about is rest and positioning. Sometimes just changing your position can make all the difference. Lying on your side with your knees put slightly towards the chest help relax tension in your abdominal muscles and improve blood flow. It is a small adjustment, but it can make all the difference. The second one we'll talk about is heat therapy. This involves the use of a heating pad or a warm water bottle. The heat helps relax uterine muscles and improve blood flow. This helps to ease that tight cramping sensation. Research has shown that continuous low heat can be as effective as the use of a mild painkiller for period pain. The next one we'll talk about is the use of painkillers. These medications are very useful in the management of primary dysmenorrhea. The best ones to use are NSAIDs, or what we call non-steroidal anti-inflammatory drugs. One of the most common NSAIDs known to a lot of people is ibuprofen. These medications work by blocking prostaglandin release in the uterus. By blocking prostaglandin release, NSAIDs block the pain from the source, not just mask it. Now, there's something a lot of women do not realize. Timing matters. Painkillers work best when you take them before the pain starts. I know of a woman that starts her pain medications a day before her period starts, because when the pain becomes intense, the uterus is already contracting and blood flow is already reduced. So it will take the pain medications a longer time to work. If your cycle is regular, it is perfectly fine to take your pain medications 12 to 24 hours before your period starts, and you should continue them for the first 2 to 3 days of your flow. Always take them with food to protect your stomach and follow the dosage written on the label or as prescribed by your doctor. Now, if you can't tolerate NSAIDs, maybe because of stomach irritation, ulcers, or other conditions, you can use paracetamol. It is not as effective as NSAIDs because it doesn't block prostaglandin release in the uterus, but it can offer some help, especially when combined with heat therapy. Next, let's talk about hormonal options. For women with severe pain or secondary causes like endometriosis and adenomyosis, hormonal treatment can be very helpful. Hormonal contraceptives, patches, and hormonal intrauterine systems work by stopping ovulation. When ovulation is suppressed, progesterone and prostaglandin levels stay more stable, which means lighter periods and less cramping. It is especially helpful for women who need both contraception and pain control, but it should always be prescribed and monitored by a doctor. Now, simple lifestyle habits can also help with period pains. Habits like exercising regularly, drinking a lot of water, reducing your caffeine intake, and getting enough sleep. All these help support hormone balance. Now, when should you see a doctor? It is important to know when period pain stops being normal. See a doctor if your period pains are getting worse, home remedies just aren't working anymore, the pain starts before your period and lingers even after your period has ended, you are experiencing other symptoms like bleeding between periods, pain during sex, unusual vaginal discharge, or you're even finding it difficult to conceive, so see a doctor. Get checked and get the right help because period pain shouldn't control your life. If you found this video helpful, please like it and consider subscribing to the channel for more clear and simple health conversations like this. Until next time, stay healthy and be kind to yourself.